I had gone for my normal mammogram, thought nothing of it, and about a day later, I'm in my car and I get a call from the nurse. And she says to me, "Are you driving?" And the minute she said, "Are you driving?" I said, "I have breast cancer, don't I?" And she said, "Are you driving?" And I said, "Yes." She said, "Would you please pull over?" And I pulled over and she said, "You need to come in right away." And I sat there and I thought, okay. My son had just come home for the weekend, and when I drove home, I finally did drive home then, and he was there, and both my husband and he just put their arms around me and said, "We'll be there." I started with the chemo and the radiation because I knew if I was going to have a 90% success rate, I would need to do the chemo and the radiation. When I sat down with him and we started making a plan, he said to me, "Chemo will take your hair." And I said, "There's no options?" He said, "No, your hair will be gone." When you first find out your cancer, that's the first jolt. And so it's like a hit. It's like I didn't choose to have this cancer. And then the second jolt was, and you lose your hair. I thought, I don't even feel sick. I thought, okay, but if this is what I really need to do, I will do this. And I went through and I would try on a wig and I go, this is just not me. It's just not me. That day she sat me down, she said, "Shirley, have you heard of these cold caps?" I said, "What are you talking about?" Our mutual friend, Kathy, had used them. She said she didn't lose her hair. I said, "I didn't even know she went through it." She said, "No, she did not lose her hair." I said, "Really?" And it was in that moment that I could feel that little bit of light come back in me that said, I might have a choice here. It changed everything. It absolutely changed everything. And it was no longer about having this disease. It was, how can we do this? Is this going to work? We were like on the ground floor of all of this. And so I went back to my oncologist and I said to him, I said, "Dr. Zander," I said, "have you heard of cold cap therapy?" And he said, "Yes, back in the 80s, but it didn't work, but maybe now it will work." In his mind, he told me later, he said, "Shirley, I never believed it would work." I said, "What did you do? Look at me and think, oh yeah, this poor lady thinks she's going to save her hair, and she's not." and he said, "Yes, that's kind of what I was thinking."
Hair loss to our patients, particularly women, breast cancer or others, is one of the biggest things that people are afraid of with chemotherapy. And so seeing this initially work was wonderful. And then knowing that it could work and then trying to figure out or expand that a little bit was great.
He just let me go forward with this whole project. And the more I talked to different people and I talked to Nancy, we just really started getting excited about this.
I think the most special moment for me in this entire process was the morning of Shirley's third chemo. We always showed up at the infusion center right when the doors opened at 8 o'clock in the morning because it was a long day with the caps. A 2-hour infusion was about a 7-hour day. When we walked in on the morning of her third treatment, she rightfully shouldn't have had a hair on her head. And Shirley walked in with a full head of hair halfway down her back. The entire staff was lined up at the door to see her come in. And when she walked in with all her hair, there was applause. There were nurses with tears on their cheeks. It was really an incredible goosebump moment because these are medical professionals who deal with chemo, 5, 6, 7 days a week, and no one in their experience had ever saved their hair through 2 chemo treatments with her medications. We looked at each other and just said, if this works, we have to do something about it because patients need to know that there's a possible way to save your hair. And Shirley said, okay, I have 3 more treatments to go. Let's plan on doing something with this. And if I still have my hair at the end of the 6 treatments, we're on. And we decided our mission needed to be creating awareness of the existence and efficacy of cold cap therapy or scalp cooling, as it's also called. We just felt that people couldn't make a choice if they didn't know there was a choice to be made.
And that was kind of the beginning of how we even decided to do the Rapunzel Project. When we launched our project, Kenra was also looking for a project to get behind, and they just felt it was a perfect match. And it was so exciting for them to know that there was a possibility that hairdressers would not have to shave one more head of hair. They thought it was a perfect marriage, and so did we.
But the Rapunzel Project launched officially in January of 2010 when Shirley had her last chemo treatment and walked away with about 95% of her hair. And we've been off to the races and working hard at it ever since.
And you as stylists have that very power within you to change the course of any client that comes to you that says, I have cancer and I'm going to need to lose my hair. And you now can tell them, no, you don't. You can choose to save it. Let me tell you about cold cap therapy.